Working past 65, should I take employer group insurance or Medicare? Decisions. Hi, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. There are a lot of people that still continue to work past age 65, some because they want to, others because they have to. And it's one of those questions that people ask a lot of times is, well, sometimes they don't even ask. They just say, well, I might as well just keep my employer's health insurance because they're paying for it. And I pay little or nothing, so it's basically free coverage. Why not just keep that until I'm ready to retire? Well, that certainly is one way of looking at it. But let me throw out another way of looking at it. If you decide to work past 65, you need to go ahead and sign up for Medicare Part A because in most cases, Medicare Part A has no premium. And you can get some benefit out of it. My wife got some benefit out of it, unbeknownst to me and her. It was kind of a surprise gift. But she fell in January of this year, and she broke her hip and ended up in the hospital for 4 days, I guess it was. And even though she's still working and covered under her employer plan, she didn't listen to me, of course, but even though she's still working and covered under her employer plan, who was primary, Medicare kicked in and paid $2,300 or $2,400 of her hospital bill. Well, that was a free gift because Medicare hadn't paid it. Well, I would have had to pay it. So keep your Medicare Part A unless you've got a really small group plan, fewer than 20 employees. You probably don't need Part B, which is the outpatient. And there's no reason to pay the premium. Currently in 2019, it's $135 a month. No reason to pay it if you're not going to be using it. But let's get back to the original question. Should you continue on group insurance or should you go on Medicare? Well, let's look at it like this. Even if your employer coverage is free, or let's just say it's $100 a month for your share, just for you. We're not talking about any dependents now, but just for you. But let's just say that your health insurance is $100 a month for sake of simplicity. And with that, well, you've got co-pays, you've got deductibles. Most of the group plans now have deductibles of at least $1,500. And if you have a really large claim, you're looking at least $2,500 out of pocket. In many cases, it's a lot more than that. In my wife's case, her out of pocket is close to $6,000. Well, that's a lot of money. Well, some people may consider it's not a lot of money, but I think it is. I hate to come up with $6,000. I can, but I don't want to do it. So let's just say your out-of-pocket maximum for your group insurance plan, if you have a bad year and you run up a lot of medical claims, somewhere between $2,500 and $6,000, and for that you're paying $100 a month. All right, let's compare that to Medicare and a supplement plan. All right, first off, original Medicare doesn't have any networks, so you don't have to do this PPO, HMO crap where you have to get referrals and you have to ask the insurance company, will you please pay for this test, or please pay for this procedure, so that I can get better. You don't have to go through that kind of crap when you've got original Medicare. Original Medicare has no networks. You can go to any doctor, any hospital, anywhere in the country. So that's a plus right there. No referrals, no paper claims to file. I mean, it's pretty straightforward, to be quite honest. And let's also say that, okay, you want a supplement plan, and because original Medicare, you have deductibles. You have a hospital deductible of about $1,300. This is 2019. Your outpatient deductible is only $185 calendar year. That's not so bad. It's a lot better than what you're looking at otherwise. And after you satisfy your deductible, Medicare picks up 80%. You're only responsible for the other 20%. but you're responsible for 20% without a cap. This is where it's different from your traditional health insurance, your group insurance plan. Like I tell people, well, with Medicare, when you get into the 20% area, you pay until you get better, you run out of money, or you die. Well, two of those options are not really very good. But anyway, so a lot of people do buy a supplement plan. Your Medicare Part B premium for most people in 2019 is $135 a month. So if you're paying $100 a month for a group plan that has a big deductible, a couple of $1,000 and a couple of $1,000 more out of pocket, well, okay, you're saying, yeah, all right, what is it with Medicare and a supplement plan? Well, I just told you, Medicare Part B that you have to pay for if you're going to get a supplement plan is $135 a month. Now you can pair that with a high deductible plan that is going to run you about $60 a month. Now, this is for somebody age 65, non-tobacco user. About $65 a month, $65 a month. So now you're looking about $200 a month for a plan that has no networks, and your out-of-pocket is limited to $2,300. You can use any doctor, any hospital, anywhere, as opposed to $100 a month for the employer group plan, and you've got to play by their rules, not your rules, and you've got a lot more out-of-pocket. Well, that right there is something to consider. And so I just throw that out. You know, you decide. I mean, there's other plans. That particular plan is one that it's not real popular, but because most people don't even know about it. They don't talk about it. You know, agents don't talk about it. Carriers don't talk about it. But you know, it doesn't mean that it's not right for you. It doesn't mean that it is right for you. Maybe as you're approaching your retirement years, maybe a $2,300 deductible is too much. Well, how much is that? About a $6,000 deductible with your group plan. The point is not to convince you one way or the other, but rather make you think about options, and don't just automatically assume because your employer coverage is free or you only pay maybe $100 a month or something like that, that that's the best thing to do. Explore your options and then decide. It may be that your employer plan is what you should do and you keep it until you're ready to retire. Or they say, there's the door, why don't you go ahead and leave? But it may also be that Medicare is right for you. And so all I ask is, hey, give me a call. We'll talk for 10 or 15 minutes, you know, however long you need to talk. I'll answer all your questions. There's never any pressure to buy. This is the no selling zone. But you know, just give me a call and we'll talk about it. If you like what I have to say, then great, and we'll move forward at your pace. If you don't, we just part as friends. After all, it's not personal. It's just business. It's not personal. So you take care. Have a great day. This is Bob Vineyard with the Georgia Medicare Minute.